All right, good morning, everyone. My name is Jonathan Liu. I'm one of the current residents over at Brown. I wanted to thank the AHF for putting on a great conference and giving me the opportunity to present our work. I want to thank my mentor, Dr. Cohen, and I want to thank everyone for showing up this morning. I know I had a great time last night. I'm sure I'm not the only one who's a little sleepy this morning. So some quick background. Discordant approach, meaning using a different approach on a revision toe hip arthroplasty compared to the index approach. The impact of that is not currently well understood or well investigated. There are theoretical concerns about increased soft tissue disruption of native planes, which could lead to instability or higher dislocation rates, though that has not been validated in the literature yet. And as we see from this weekend, there's an emerging role of DA both in index and revision approaches, and I think this is a very timely topic to look into and discuss. Which brings us to our current study. The objective of our study was to investigate associations between discordant versus concordant surgical approaches in revision toe hip arthroplasty when looking at common postoperative complications. The approaches in question are direct anterior, anterolateral, and posterior approach. So we performed a retrospective chart review of 335 patients who underwent revision toe hip arthroplasty. This was done at Brown and Rutgers. We collected basic patient demographics, obviously primary and index and revision approach, and then looking at common postoperative complications. Student t-tests and chi-square tests were used to analyze our findings and determine any associations. So quickly on demographics, there was no difference between age, ASA, or medical comorbidities, or gender between our two groups. There was a slightly lower BMI in the discordant group compared to concordant. It's likely possibly attributed to the fact that surgeons may feel more comfortable using a different approach in patients with more suitable body habitus. Notably, we had 73 patients who underwent direct anterior revision, and within that, 27 of those patients had a different approach, or had a direct anterior approach. In terms of postoperative outcomes, I apologize for a slightly busy table, but we found a shorter length of stay in the discordant group. Otherwise, when looking at complications like EBL, length of dislocations, overall complications, readmissions, transfusions, there was no difference between complications. From there, we wanted to look into this a little deeper, so we broke it down into three groups based off of the index primary approach. So if you see, there's a column for index posterior, and then whether the revision approach was posterior or a different approach, categorizing as discordant. And this was done for all three index approaches. Interestingly, there were still no significant associations with complications with discordance. And then finally, I think it's always important to know your audience, so we wanted to look into whether there were benefits with direct anterior approach in the revision toe hip arthroplasty setting. We found that there were shorter lengths of stay with the direct anterior revisions. There were lower discharge rates in nursing facilities, lower 90-day readmissions, and overall complications. I think that's a reflection of, as we all know, the direct anterior approach is muscle sparing, allowing patients to mobilize and recover faster. And I think these findings are a reflection of that. We also found higher rates of discordance in the revision anterior group. I think that's a reflection that at our institution we're becoming increasingly comfortable with doing direct anterior revision, regardless of what the index primary approach was. So in conclusion, I think our preliminary findings were significant for suggesting no differences in postoperative complications when looking at discordance or concordance in surgical approach. My big takeaway from our findings so far are I think surgeons should feel comfortable with their preferred surgical approach, whether that's direct anterior or posterior, and whether that's in the index or revision setting. We did find significant benefits with direct anterior approach and likely associated with faster postoperative recovery and complications. Thank you.